Social Isolation in the Elderly Population by Tanya Piccioni. Back in 2022, there were almost 58 million people over 64 years old living in the US. That's a huge number, and this older population is growing faster than ever. In fact, by 2034, people 65 and up are expected to outnumber kids for the first time in US history. Sure, we're living longer thanks to medicine, technology, and overall better public health, but that also means a lot more pressure on the healthcare system. As more older folks need care, it can strain the system and change how we use our resources, possibly making things tougher for everyone. Older adults deal with a bunch of ongoing health issues. Think heart disease, diabetes, arthritis, dementia, and all those issues need ongoing regular attention. In 2022, about 90% of them were on prescription meds, but only 25% got help for mental health concerns. We might never get to a point where everyone's needs are totally met, but these numbers show we've got to do more to help seniors stay both physically and mentally healthy. Social isolation is a big deal for older adults. It can cause or worsen problems like high blood pressure, heart disease, obesity, weak immune systems, depression, anxiety, cognitive decline, Alzheimer's, and even early death. There aren't exact numbers to measure if we're making progress in fixing this problem, but there are plenty of initiatives trying to make a difference. In May of 2023, U.S. Surgeon General Dr. Vivek Murthy spoke out about loneliness and social isolation, calling it a public health crisis. You can scan the QR code if you'd like more information on his advisory statement. It's a very interesting read. In summary, he lays out 6 main steps: improving local communities for socializing, making policies that encourage connection, building social connection into healthcare, tweaking digital spaces to be more supportive, doing more research, and creating a culture that values kindness and service. If we jump on these issues now, we could lower the pressure on the healthcare system and help everyone live better lives. Now, the health belief model is basically a way to understand why people make certain health choices based on what they believe. It started out trying to explain why people do preventative health stuff. The model says our actions come from our beliefs about health issues: how serious we think they are, what we think we'll get out of taking action, what holds us back, what reminders we'll get, and how confident we feel about making those changes. In short, perceived susceptibility is how likely you think you are to have a problem. Perceived severity is how bad you think the problem is. Perceived benefits is what good you think will happen if you take action. Perceived barriers is what might stop you from taking that action. Cues to action are those little nudges or reminders that push you to do something, and self-efficacy is how sure you are that you can actually make the change. The health belief model can help us figure out how to reduce social isolation in older adults. Each part of the model matters. Take susceptibility. If we teach seniors that being socially isolated can mess with their mental and physical health, they might realize that this could happen to them. This might motivate them to seek out social activities. If we show them the benefits of staying connected, like better moods, sharper thinking, and feeling overall happier, they might even be more encouraged to join in. But we have to tackle the stuff that gets in their way too, like not having a ride, feeling shy, or not being able to get around easily. And if we point them to solutions, like local events or transportation provided or support groups, they're more likely to join in. Also, things like newsletters, doctors telling them about events, or community flyers, those things can serve as cues to remind them to reach out. And as they try more and more activities and realize they can handle them, their confidence or their self-efficacy grows, making them more likely to keep at it. We can create an intervention that focuses on showing seniors their risks or susceptibility, tackling stuff that makes it hard to get involved, like barriers, and boosting their confidence or self-efficacy. For example, we could have informational sessions, pamphlets, and talks by trusted healthcare folks so older adults can understand what isolation does to them physically and mentally. Hearing real stories from people who overcame isolation can help them see that they're not alone and that they can improve on their own situation. To handle barriers, community programs could offer rides, volunteer companions, and help with learning tech so that they can connect online. By pairing up with local services or volunteers, We can make sure that they have an easier way to get to events, making sure gatherings are welcoming, like having enough seating, simpler exercises, and quiet spaces. Those things also help. To boost self-efficacy, we just need to start small. Short walks, board games, or crafts that are low pressure. As they enjoy these activities and see that they can do it, they'll feel more comfortable trying bigger things. Giving them positive feedback along the way can really help them believe that they can stay connected. This intervention is designed to help older adults feel more connected and less isolated. First, it raises awareness on how isolation can harm both mental and physical health, making people realize why staying socially active is so important. Next, it focuses on removing practical barriers, like difficulty getting to events, so it's easier and more appealing to join in. Finally, it helps build self-confidence step by step, offering positive feedback and support as older adults start to participate more in their communities. Taken together, these actions can improve their overall well-being and reduce the health problems linked to isolation. Plus, as seniors stay healthier and more connected, it eases some pressure on the healthcare system. By increasing awareness, making activities accessible, and boosting self-confidence, this approach supports long-term engagement and ultimately helps older individuals enjoy a better quality of life.